Sandra. Let's move on, shall we, and talk about health concerns, because the number of patients in hospital with flu has quadrupled in the last month. This is according to NHS England. 5,074 patients with flu in hospital. This was on Sunday last week, up from 1,190. So a five-fold increase, really. They're saying quadruple. It's actually more than that. 4,469 patients averaging in hospital with flu every day. Now, just in terms of that, it means that the flu season has arrived early, but also we're seeing this quademic in the NHS. The NHS always struggles at this time of year. It seems to be happening much earlier. And of course, we know that Keir Starmer is going to make some sort of speech on Monday about the state of the NHS and his plan for the NHS. Joining me now is Dr. Aneez Esmail, who's an Emeritus Professor of Family Medicine and General Practice at the University of Manchester. Good morning to you.
Good morning.
Really good to talk to you. I mean, look, we expect flu every single year. For many of us, particularly if you're young, it's a self-limiting illness. It's not very nice to have, you know, high fever. You know, you feel pretty dreadful. But there are real concerns about elderly people, those people who are vulnerable, chronic conditions, and those people are hospitalised. And also the hospital's just simply under so much strain.
Yeah, no, exactly. And it's a recurring problem every year, every winter. We get this. And I think this is why there's a huge campaign that starts in September to get people to have their flu vaccination. And that's the best preventative that we know, really. So really, it's still not too late to have your flu vaccination. And you can get them in so many different places, pharmacies, GP surgeries, and you should go and get one.
So I know that people will push back on that, because I think the COVID-19 vaccine has alienated a lot of people from getting vaccinations. What would you say to that?
No, I think you're right. It has, unfortunately, because of the way that people were forced to take the COVID vaccine. It has made people very against it. But the influenza vaccine has been around for years. Every year it is modified and changes, and it does offer protection. And it's very sad, because many people said at the time that it was wrong to compel people to take vaccines. Now, this is entirely voluntary, and elderly people who are vulnerable, can have it, and in fact anyone can have it, but there's a group that have to pay for it. But it's not expensive, and they should get it done.
And of course, this comes on top of this quademic. So we've got flu, COVID-19 is still around, and obviously there are those people who are suffering from that. We've also got RSV, norovirus. Do you just want to say a bit about those?
Well, they're both infectious viruses. Again, because they're viruses, things like antibiotics don't help. I mean, norovirus is self-limiting. You feel pretty miserable with it, but you get over it very quickly. And then RSV is respiratory syncytial virus, which actually is a respiratory virus that affects a lot of young kids, but again, self-limiting. But unfortunately, people with some ongoing conditions and so on, if they get it, they become very ill with it. But it's there. But again, there are now vaccines available for this. So I think you know, it's very sad, because it is a time when the NHS is under huge pressure, and then you have all these cases, and then there are other areas like the difficulty people have getting GP appointments and so on. So people end up going to casualty, you know, and many often get admitted. So it's really very difficult for the NHS at the moment. I accept that.
It certainly is. Also, just that the sheer numbers of people. There's another story. More than 1 million patients in England were unable to contact their GP at all throughout December. 2.2 million people had to wait several days to get hold of their doctor. 1.1 million failed completely. Even when they got an appointment, fewer than half actually received a face-to-face meeting. 100,000 people told to manage it themselves. There is a real crisis, isn't there, in primary care?
Well, yes, and I think, I mean, we always talk about crisis, but this has been brewing for many, many years. You know, it's not happened in the last 4 weeks. This is tens of years, I would say, probably 15 years of underinvestment in primary care. And it's really important, because in the NHS, primary care is the linchpin of the NHS in a way. And if primary care fails, then the whole system fails.
So can I just ask you about that? Because
yes.
GPs are independent contractors, aren't they? And,
yes, they are.
And they're paid on a capitation basis. So i.e., the ideal scenario for a GP is to have tons of people who are well and young.
Yes. Well, it's more complicated than that, but yes, capitation is a big part of the payment of GPs. Not all GPs. I mean, I worked in a social enterprise, so we were salaried,
Yeah.
so it wasn't the case. But that is the main model, and yes, but at the same time, you can't pick and select who you want to have, really. And
No.
the reality is the GP is a community resource, and people go to their GP to register so they can get help locally, and that's how it should be. The problem has been, though, because of the underinvestment, because GPs are private contractors, and if money's cut back, then they can't have the resources to employ more GPs, or other staff like practice nurses and nurse practitioners and physician assistants. So this is a real problem, and I think that the government recognises this, and I think there has, they've talked about this from day one, that they're going to refocus the NHS more towards primary care and away from hospital. But of course, this is going to take time to get in place. But I think there is an understanding where the problem is, and sadly, we've got a very severe winter. We've got this pandemic. And obviously the point is that if you can't see your GP when you have flu-like symptoms and you want reassurance and you might even need some treatment, the best place to get it is your GP surgery. And because you can't, people turn up in A&E and then they see a junior doctor frequently who needs more support and help. And it's not unusual that people get admitted once they get there. Whereas if they're seen by their GP knows them. GP has lots of resources that they can put in place. We have nurses, we have other people who can visit them, and we can bring in place social services and so on. So there's a lot that can be done in the community that can avoid hospital admission. And hospitals are not very safe places, actually. It's a very common place. You go in without something, and you frequently can get a chest infection in hospital itself because of the environment. So it's much better to be able to see your GP, to get treatment, and to stay at home when you have these, if obviously you're able to stay at home.
And obviously, I mean, there is a huge crisis in social care. We know that report won't now come out till 2028, which I think is far too late. But Keir Starmer are going to make some sort of statement on Monday about GPs. My understanding is the reforms they're going to put forward will mean that GPs can essentially circumvent a consultant. This is my understanding of what's coming. Would you welcome that, so that GPs become a much better gatekeeper? Because my friends who are GPs all say the bureaucracy is off the scale at the moment. No,
you're right. And I've been a GP. I've now just retired, but I was a GP for over 30 years in the NHS. And I would say that, I was able to do a lot more even 10 years ago.
Yeah.
And things have improved. I mean, we have better access to things like MRI scans, but there's a lot more tests that could be made available. And, GPs are expert generalists, I would say that probably 90% of what people have can be dealt with and managed in general practice. And that's why you need the resource there, because that prevents people going to hospital. You've got to have good systems, you've got to have trained staff. And then if you can get to see your GP, and the point is that because of COVID, and it happened in our practice, we are able to give a lot more advice on the phone. We have better systems. And many people welcome that. You don't always have to see a GP. And in GP practices now, there's a lot more staff. We have nurse practitioners, physician assistants, we have mental health workers, we have physiotherapists. So it's changing hugely. And people can see a wide range of people in order to get help with their condition. And that's always a positive thing.
Excuse me, I think the kicking social care into the long grass until 2028 is a huge problem. Also, is general practice still something that junior doctors want to go into?
Well, it's increasing. I mean, I think there was a period, again, because there was lack of investment, people looked at general practice as they were graduating, saying, I'm not going to go in there, it's just problematic, not enough funding and so on. But actually, in the last 3 or 4 years, things have begun to shift. And we see this, that there's many more people choosing to do general practice as their first choice. When I graduated in 1982, it was the most popular specialty, and I would love to see it back there again, because it is a really fulfilling career, and it's a great career for a doctor. And I think that with the right reforms in place and the right investment, it will be the best profession, really.